Residents in Hammanskraal are not alone as they face the cholera outbreak. Doctors Without Borders has set up a 2-bed treatment unit in the community of Kanana, the centre of the outbreak. The organisation has also supplied residents with hygiene kits. Cholera has claimed 23 lives in Hammanskraal, and scores of people have been treated in hospital as well. Let's find out some more about what's happening on the ground. We're joined by Doctors Without Borders, a medical manager in the country, George Mapiye, who joins us virtually. George, thank you so much for your time. Your organisation has been on the ground in Hammanskraal since the 26th of May. Tell us what they found and what you decided to set up in order to help.
Well, yeah, thank you for having me, and thank you for being concerned with this situation that we're having in the country. So following the first reported cases of cholera in February, we were, as Doctors Without Borders, have been following up to see how it is evolving. Then from the 26th of May, as you have rightfully said, we were invited by our partner, Department of Health, in responding to cholera. So what we did is we have been supporting with case management, technical expertise in the Hospital of Jubilee, and as well as taking priority for making sure that we reduce the cases to flow into the hospital by being in the community, setting up what is called a cholera treatment unity, where it reduces the load that goes to Jubilee Hospital, but can treat and give health education to the community closer to where the hotspots are.
And what's the reaction been from the community? I believe the MSS is the existence of the unit that you've set up is being communicated via loud hailing through the community. How important is it to get the word out that you are there to help?
Yes, thank you. So working together with different departments has helped to reduce the cases that we could have had if we had not intervened as health practitioners as well as other stakeholders. So there is a team of community health workers that is managed by another department, which is taking the messages in a global health promotion package where they share the awareness. They give health education. They also give some instructions on how to prevent getting cholera. So they are sharing within the communities of Kanana in Hammanskraal, as well as other communities where the cases are just a few. So this is really helping the community members from utilizing the items that have made them to get cholera.
I understand the MSF has also donated 1,000 hygiene kits that comprises quite a few important elements that you've learned in your work across the continent is important in breaking the cycle of cholera. Explain to us what is in those kits and how important it is.
Correctly. What we have done as Doctors Without Borders, we have looked into the items, the utensils that people are using within their homes, and we have been donating 20-liter buckets. We've been donating tablets to treat within the house the water that they get, no matter where they get the water from. But we have been making sure that the water is treated to make sure that it is clear for them to eat. We have been donating cups, plastic cups, and other items that are of several domestic use.
George, just in closing, because sadly we have run out of time. Obviously, time is of the essence, and I'm sure you'll be able to tell me that from experience in dealing with something like cholera. What happens now over the next couple of days, next couple of weeks to try and turn the tide on this outbreak in Hammanskraal?
Yeah, for sure, we have seen that the multi-sectoral approach that is happening now has managed to slow down the spread and the cases of cholera. So for now, we continue to work within the Hammanskraal as well as the provinces around. As Doctors Without Borders, we have been assisting other provinces as well to be vigilant, to be prepared through their disaster management and other municipalities to make sure that each case of suspected cholera is treated accordingly. And for you to know that cholera, once having one case, it is already an outbreak. So we are working with all provinces to make sure that it doesn't spread as far as it did in years before.
Well, we thank you for your time, and indeed you and your team, the work that you're doing, all important, especially because of the experience that you've had in dealing with cholera. That's George Mapiye. He's the medical manager for Doctors Without Borders in South Africa.